So when you do that, you're going to want to be right here.
Just a variety and
any age, there's no restriction, there's nothing.
So say like, hey guys, we're going to have her oral here. Because last person in the treatment.
When do you start? So when you're done with the fourth, then you're going to do the rest of the skincare for 7 days after, and then start your regular skincare.
Jill, so we've been rolling live, so what I'm going to do so that we can have her this, I'm going to have her look at her stand next to it, loud. So we're going to do and then we'll check.
Okay. And please feel free to keep asking questions too.
and you can get up and get closer.
And also, if you guys would like to stand up to come over around here, kind of with a circle, a semicircle, that would be great too. And you can get a first-hand look at what it looks like and how she's feeling. And
It's good. It's good for everyone to see the treatment being done too, so you know what you're prepared for, like when we're doing this. And so we went through some of the contraindications, which are allergies to the kojic acid or any of the other ingredients in this. Yeah. No pregnancy, no breastfeeding.
Yeah, she had to check on that. So first we're going to use our cleansing. This is our it's called our pea solution. It's a cleansing solution, and we're going to make sure we have all the oils and everything off of the skin. We're just going to gently wipe.
And the other contraindication that we talked about were no open compromised skin. But this is perfect for all skin types, Fitzpatrick 1 through 6.
How are you doing? Okay with this?
Yes.
this also has a little lactic acid in it, so sometimes it might feel just a little bit spicy.
So yeah, they're just prepping her skin with the pea solution. It's just pH balancing out her skin. That's all we're doing.
The good thing about this too is that you can really customize it. So like lines in the neck area, it's working really, really well for that. A lot of people have like very defined lines on their neck. So it's working great for that. And then also we can really customize it too, up around the eyes and on the crow's feet area. It's working really well for that area too.
So does one application cover the face and neck?
No. So one application would be the face, the second application would be the neck.
So two different treatments.
Two different treatments.
Yeah, but you can treat the entire body. So again, this is a collagen biostimulator. So you are increasing collagen, and you can treat the face, the neck, the décolleté, crepey elbows, crepey knees, stretch marks, deep pitted acne scars, anything that you're using to regenerate collagen.
So is then if you face and neck, the two separate treatments, is it 4 on, if you wanted to face and neck, is it 4 on each?
Is it for, yes.
Yeah, 4 each. Yeah, that was my question
They're
too.
just two different packages, like for pricing.
But you could do both in the same day.
100%. You could do the entire body in the same day. So depending on how big your wall is. Yeah.
Jill, could you repeat what it benefits for? I think it's only
Yes.
one of the
So this treatment again, if you guys are familiar with like Sculptra, heard that product before, it's a biostimulator, right? This is a topical biostimulator. So there's no injections. You're gonna see there's no needles, there's no downtime, there's no peeling because it's not a peel. So it's actually the product's being massaged into the skin, and it contains hydrogen peroxide, contains TCA 33.3%, and then kojic acid 5%. But the TCA is modified by the hydrogen peroxide, and it actually makes the product completely bypass the epidermis, which is that top layer of skin, and it pushes the product right to the dermis. And the dermis is where our fibroblast activity happens. That's where our collagen regenerates. That's where the problem is. So we're basically able to push this product and put it right to where the problem is and regrow new collagen. So this is an entirely new category in aesthetics. It was in the injectable space for a long time. You sometimes get, us women, us men that are, we're a little hesitant to get hit with a needle, or, we're scared of looking unnatural, or we don't want too much, or how much is this? So for the first time, this is not new. This product was created in Italy in 1996 for little kids that had scars. So it's not a new product, it's just new to But it is good for fine lines, wrinkles, acne scars, stretch marks, pigmentation, hyperpigmentation, hydration. If you're, have very hydrated, dehydrated skin, it's perfect for that. It's basically just regrowing new collagen. Like, I think of collagen like the concrete of my house, right? As we age, the concrete starts to shift and break. And that's why our skin starts to get loose and we have laxity. So this is basically a product that's going into that area and regrowing that concrete, if you think of it like that. So, and we have lots of before and after pictures. There's millions of them. Sorry. Yes. But yeah. Thank you. Yeah. And I have had 4 treatments done so far, and I thought that I was going to need like an upper eye block here, and I will tell you, because all the girls in here know me, I have felt like my eyes are completely lifted with this product. It's awesome. So for me, like downtime, I don't have downtime. I have 3 kids. We don't want to get hit with the laser. We don't want, 2 weeks of being home and putting Aquaphor and all the other stuff and CO2. A very good friend of mine, we treated her mom 3 weeks ago, and she has results of like a CO2 treatment, and she did no laser. Like I showed you the picture earlier. Like it's remarkable. So
now you do 4 of them, and then you go back for maintenance.
So I'll talk about that, right? So if you have deep pitted acne scars, right, you're looking probably more towards like 6 to 8 sessions. But if you're coming in just to treat your face, like our beautiful model here, you're probably gonna do 4 treatments once a week. They suggest that you come in once a week because that's when, I guess, your fibroblast activity, if you think of it, gets hungry for more. So they want you to come in every 7 days for 4 weeks. Your results are gonna last 6 to 8 months. You're gonna see the best result at 3 months. So if you're considering, like, consistent with your 4 treatments, that's the way they're set up to do it here. But you can treat your whole body. Like, you start with that base, and then, browns and reds, like on your chest, and décolleté, a whole bit. I've seen lots of treatments. So what Elena's doing is just pushing a little bit of the product out. This is just a syringe to push the product out, so nothing's being injected. And she's rubbing the product around, and then she's going to apply about 3 to 4 pounds of pressure, just pushing the product into the skin. And tell me your first name again.
Claudia.
Claudia, okay.
So it does, like when she pushed it out, it did trigger a little bit of my forehead. So
Yeah.
just like
You might feel like a little bit of a stingling, right?
Yeah, like that.
And you push down and press out. Press out. Yeah, push and press out. Yeah, perfect. And you're basically just pushing the product in. Yep. And that's when you would say, Claudia, on a scale of 1 to 10, how are you feeling?
Good.
Feels fine?
Yeah, totally
Yeah.
fine.
Okay, great.
So
Now
we're just,
we're gonna put more on.
Yeah.
So we're,
so there are 3 areas. So the forehead, and then the cheeks, and then the mandible, where we're gonna do basically about 1 to 5 passes, depending on your skin. But Elena's just spreading the product around and just pushing the product down and pushing the product in.
Can it go on your eyelids to
You
help
can,
that?
so you can actually treat, and I've had mine done before, you can go right over the eyelids. And so that's a great question. And I've actually treated right under my eyelids. So
with that amount of pressure.
So not a lot of pressure, like underneath the eyes, but
No,
you
like
do
we
need
have like
enough, but yeah.
We have like a cotton swab, the pressure with it. Inside of the glove, I have a cotton swab, and you can fully shut, like if we do the lines here, we can press. Yeah, I can see it. So she's not feeling sticky yet, so. So I'm gonna go ahead, I guess I can do this.
So we're gonna do the forehead first, then we're gonna do the cheek area,
Okay, so
and
we're
we're
gonna do
just,
one more.
yep, perfect.
We're gonna do one more pass.
And-
Okay?
Yeah.
When do you start noticing the effects? I'm sorry.
So after the first treatment, you're gonna see a noticeable difference. Definitely. You're gonna see definitely.
After what, 24 hours?
So actually, it's immediate. You're gonna see an immediate glow, and then probably the next morning you'll wake up and people will say, "What the heck did you do to your skin?" Like it is a glow. They talk about the PRX glow.
Okay.
So yeah, but you're gonna see immediate results. I have heard that after the third treatment, that's when your skin really starts to take a turn. So, but you're definitely doing at least 4 to start. Yeah. Yeah.
Oh, you want to? Okay, yeah, sure.
And then we can let Felicia do it too. Fun.
Okay.
And PRX stands for peroxide. It's fun. Anyone was curious.
Felicia's gonna
It's
do
fun.
your cheeks. Okay, take over.
That's how we do things here. We just
That's right. We switch it up. And so I think she did three passes on her forehead. Yep.
So it should be feeling, actually at this point patients are like, oh my gosh, this is actually really relaxing. So they think they're having a little facial massage
Yeah,
as
I don't
well.
mind. You can look at it.
Yep. And you can also combine this treatment, like we were sharing earlier, with different modalities. So if you wanted to incorporate laser into this treatment,
Hydrofacial. I just had a patient the other day.
100%.
Hydrofacial, and then we finished with this. Oh my gosh, that patient was like glowing when she left here.
Mhm.
She was so thrilled. She actually texted me later that night. She's like, my husband wants to know what I did in my skin.
Yeah.
So yeah, we're just kind of pushing it in, and like she said, it has the hydrogen peroxide in it, so it's literally bypassing the epidermis. It's going right into the dermis where we want it to be. And are you feeling like a little tingly, maybe like 4-ish, maybe
Not on my cheeks. I feel
on the forehead?
Yeah,
Yeah.
on my forehead I definitely feel it.
Yeah, it hasn't worked its way down to the cheeks yet.
But it's a very comfortable treatment.
Yeah.
There's nothing.
Yes, it is very
right. It's
comfortable.
nothing.
When we're finished, literally her skin will be glowing, nice and glowy. Her forehead's gonna be like, looks like she just had Botox.
And again, this is a new category in aesthetics. It really is. It's not new. It's just new.
Yeah,
we're so
if you were
used
to put the 33% TCA acid on your face, you would be like frosting and you would hate me. So you're getting 33% TCA trichloric acid going right down into that dermis.
Elizabeth R. had a question.
Yes, Elizabeth.
Elizabeth wants to know, how long after filler should you wait to do this treatment?
It's a great question. So you can actually do this treatment the same day as filler. You would just do it right before, because as you can see, we're massaging. So you're going to be doing this treatment first, and then you can do filler right after. If you're going to do filler first, I would give it at least 2 to 3 weeks, because that's how long it takes for filler to kind of settle and get integrated in. But you can certainly do this treatment right before Botox. You can do it right before filler. You can do it same day as a non-RF microneedling treatment. If you have CO2 that you want to do, they have a whole protocol for that. You can do this right before right after a hydrofacial, right before after dermaplaning.
Right, or microdermabrasion.
Yeah, this can be combined with anything that you guys
A
are
lot
doing.
of patients are doing the Morpheus 8 treatments now, and they're wondering how to combine that in.
Yeah.
If you want to talk about that.
Yep, so you're going to be doing this basically a week before. So you can't do the Morpheus plus this treatment the same day. So, but we have protocols for all of it. But
I do feel the tingling now.
Yeah,
Cheeks, by the way.
It catches up.
and it's
Yeah.
like a little stingling, right?
Mhm.
Nothing terrible.
No, nothing terrible.
No. And
Just
this,
the pressure of the rubbing it in
Yeah.
is the most.
it feels good, Grace.
It does
I
feel
mean,
good. It feels like a massage.
Yeah, it does.
It really
Did
does.
you have another question? Was there another one?
Oh, no, I think the
Oh, I
question.
thought there were
Oh,
another.
there is? Oh, there is
Please feel
another
free. If you
question.
guys are at home and you have
Okay.
questions.
Can the
Yeah,
treatment be
yes.
performed at any age? Yes.
Yes,
That's a
it's
yes.
any age. So again, this was created in Italy in 1996 for little kids that had scars.
Oh.
So that's a big thing. Like, you can do it on any age, any skin type. So to have any skin type, to have a treatment that you can even out skin tone. If you are a skin type 6 and have deep pitted acne scars, there's very
Amy, that's what you
little.
were asking about.
Yeah, very little that you
Acne
know.
scar.
Yeah, especially like teenagers, like, you know, if they're 17 years old and they have skin type 6 with acne scarring, like for the first time now, you can come in and do a topical treatment and get the results.
Oh,
So,
why is it different? How is it different from a peel? How is
that's a great
peel?
question. So, if you think of the layers of the skin, right? The top layer of your skin, that's your epidermis. And then you have the dermis, which is down below. The epidermis is where, say the question again. What was your question?
Oh, how is the PRX different from a peel?
From a peel. Okay, so all of your peels, your chemical peels, even this bio-repeal thing that's out, and they say you don't peel, they are all still working on that top layer of skin. So they work great for the top layer of skin, but the difference with this product is that the ingredients in this product actually, when being massaged in, they bypass the epidermis, that top layer entirely, and they push the product right to the dermis. And the dermis is where your fibroblast activity happens. That's where your collagen regenerates. What's that?
What number would you say?
But that's the difference. So this is an entirely new category. This peel is not even in the same neighborhood. This is a completely, think of this product more like Sculptra without the injections. If you're familiar with Sculptra, it's a topical collagen biostimulator. So it's completely different. Can you do both? Can you do a peel? Can you do this? I don't see why you would need both. This is doing the same thing as a peel. Think of this product going to where the problem is. The problem is where your dermis is. That's where your collagen is regenerating. So you're basically lifting, and it also helps with pigmentation. I think of this product like as an IPL, if you're familiar with IPL, which is a laser that's helping to lift pigment and browns and reds. And then think of it as a collagen regenerator.
The main difference with Sculptra though is that it's not providing volume, right? Like Sculptra, you'd be volume plus stimulating collagen.
It's a biostimulator too. Like it's a collagen biostimulator.
Right.
So, but that product has to be injected. It has to be injected by a very, very experienced injector. It's permanent. You have to make sure that you're getting it done and putting in the right places. Also, there's a lot of maintenance with Sculptra. You have to massage your skin like five times a day for 5 days. It's a lot of maintenance because the possibility of nodules like coming in. So this is just it's a lot easier.
But again, it's not. But the main thing is Sculptra provides volume though.
So Sculptra is going to it's a collagen biostimulator. So remember that concrete with the house, right? That analogy. Yeah. So it's not going to help with volume.
It's not.
It's going to help
I thought it was going to do both.
increase collagen.
I thought it was going to do both.
So filler is what's going to help with volume,
right?
If you think so. Sculptra is more like fixing the concrete.
I see. Okay.
And then your filler is more like increasing like volume loss, and it's injected in your fat pads.
Right.
Yeah.
Sorry.
No.
I thought it did both.
There are no dumb questions. If you have
It looks like
questions
it
at home,
first. Sculptra, when you first inject it, it doesn't look like it's.
Right, but
but then it just
absorb
settles
it.
down.
Yeah.
Okay.
I have a couple good questions.
I'm
More.
ready. Yes.
Is it necessary to use the home care line after treatment?
So Dr. Castellana, who created this product, she created this product with the protocol of aftercare. So I think it's crucial to do the aftercare. That's in my opinion.
There has not been studies being done with the other skincare lines.
No. And the aftercare, we're not a skincare company. It's about protocol and getting the best efficacy with this treatment. So this is the protocol after this is incorporating like a moisturizing cream. It's a shea butter that it's helping to protect the skin barrier. Can you use other products? I wouldn't suggest it. If you're looking to get the best efficacy, they've tested it all. Why mix it up? I would stick with what they're doing for protocol. So that's my answer.
All right, and so afterwards, are you able to work out, wear makeup, and or be in the sun after treatment? Of course, we do not ever encourage sunscreen on our face. I mean, always sunscreen, never sun on our face.
I will tell you, this is probably the perfect summer treatment, right? The reason that we're all in this room, all asking about our wrinkles is because of the sun. So, do we want to go out in the sun? We want to protect our skin all the time, especially with a sunscreen 24/7. I'm like a crazy person with sunscreen. But yes, the only thing that you can't do after this treatment is go and sit in a hot sauna for the next 48 hours. Like a hot shower, hot saunas. But everything else is fine. When Claudia leaves here, we're going to be applying the moisturizing cream to her, plus a sunscreen, and then she can put makeup right on on top.
Yeah, I
you
did.
go
I
right-
put makeup right on
You
top.
go right back to your regular life, you know, if you
exercise?
You can exercise. I wouldn't run a giant marathon, maybe, but you can go right back to like your regular life. This is the easiest lunchtime. We're all talking right now, but this typically takes about 10 to 15 minutes to do. Hi, come on in.
Hi, Terry.
Hi, how are you? But yes, you can go right back to everything that you're doing. So this is a great thing to do even on the day of your wedding because you're gonna have a beautiful glow to your face. It's a great date.
Right.
We had a demo
Go on a
yesterday,
date.
and the girl was going on a date that night.
Yeah.
She left. She was like, "Holy cow, she looked phenomenal." So this is the perfect thing to do.
But we don't encourage single treatments.
Yeah, we.
You have
No.
to do a whole package.
You did no. There's
So
no.
I have a question. I have a friend that
But you can do your last
really
one on your
has
wedding
thin
day.
skin, okay, and has tremendous wrinkles on her neck. Nothing really hanging, but just a lot of wrinkles, and her skin's real thin. And they, like she's asked about getting it tightened. That nobody wants to really do that. Do you think this would help?
So this is not going to be a facelift.
No, but she would like just to get
Will it
some
help? 100%. Again, we're thickening that collagen. The reason that we start to get laxity and the reason that our skin starts to get thin is because every second that you're born, every day that goes on, our skin starts to get thinner. That's it, because it's again that concrete. So would she benefit from this? 100%. Yes. And
I
the
can
more
show you a picture of her neck later.
we'll have her come in and do like a consult with that.
Yeah,
You know?
yeah.
So.
She just she got sick. She couldn't make it today. So.
Yeah, and good skincare. I will tell you, I sold skincare for many years. Like, if you're not using good medical grade skincare, like the skincare that they sell here, that you can only get in like doctors' offices, doing these kind of treatments is like throwing your money right in the garbage.
Oh, I get something.
So it's really important to use good skincare. Medical grade is the best. You can only get that at offices. So it's just think of like, your concrete. If it's not in good shape before you start doing treatments, that's important. So another question. No.
Do you suggest like a certain amount of time before she washes her face tonight? Like,
So I would let I don't know the answer to that.
Well,
I would say
she's
probably-
already washing it now
Yeah,
with the
so
cold
she-
water.
She probably doesn't even need to wash her face tonight, but it's
okay.
good to just apply the moisturizer. So this is the moisturizer they supply you with the procedure with the treatment, but you're going to apply this 2 to 3 times a day.
Oh, okay. So
Yeah.
you do this water right after.
Yeah.
Okay.
But I mean tonight, I would suggest I don't think you need to cleanse or wash your face, but I would put more moisturizer on tonight. Yeah. And then they send you home with a whole T-Care like card and all of that, which is all supplies. Hello. Another friendly face. It's fun. Any other questions? I'm here.
So your home care is going to be the next day. You're going to wash your face with a gentle cleanser. You're definitely going to be using your sunscreen. You are going to use the firming serum that comes with it that night. And then, the important thing is that you want to wait 30 minutes before applying the moisturizer.
And this is all going to be super confusing. They give you a wonderful little take-home card that tells you exactly how to make sure everything goes very smoothly. So easy stuff. Nothing complicated. But you do stop all of your regular skincare, anything that was active. Your
How
regular
soon?
skincare.
How soon before the first treat? Do you need to stop retinol so many days beforehand?
You do. So they suggest 7 to 14 days before you get your first treatment that you should stop your retinols. Because retinols, again, you guys are all familiar with retinols, they are turning your skin real fast, so they want your skin to be ready and prepared for the treatment. So you're to stop that. They also ask you to stop your antihistamines. Apparently the antihistamine has something to do with the effect of the fibroblast activity, so they ask you to stop those too. So those are the 2 things.
The same amount of time, 7 to 14.
You can, like 24 hours before for your
okay.
antihistamines, yeah.
Yeah, because
So basically, doing this treatment is so that you don't have to do retinol, right?
So you're gonna always be remember, think of this as a treatment, right? So during the 4 weeks that you're getting this done, think about you are regenerating new collagen. When you're done with the treatment, yes, you're gonna continue on with your good skincare, your good medical grade skincare. I definitely suggest a retinol or something similar.
You do encourage
Yeah.
So let's say the day after you can start using retinol, or you have to wait a while?
So, let's say Claudia starts today, and she's gonna be doing 4 treatments. When she's done with her 4th treatment, go another 7 days with all of the home care.
Okay.
And then you can resume all of your regular skincare products. If that makes sense. Does that make sense? So just think this, 7 days do another treatment, 7 days do another, and then when you're done with the 4 treatments,
Then you
another
do your-
7 days of post-care.
So 7 days after the 4 treatments?
Correct. Yep. And then again, after your 4 treatments, you're gonna see the best result at 3 months. So that's when I would suggest coming in, let them take all your before and afters and all of that. But after the 4 treatments, the results last 6 to 8 months. And at that point, like we talked about earlier, you guys can do maintenance once a month, do another series of 4. There's nothing that says you can't continue to do it. Unless we're all living in a cave, then we're never gonna age anymore. You're always gonna be needing to regrow new collagen. But most patients I have found, they start with their face, and then they're like, oh, I didn't know I could do my neck. I didn't know I could do my décolleté. I didn't know I could do my, crepey elbows, or my stretch marks, or, my acne scars, all of it. Tummies, it's great for tummies. It's perfect for all parts of the body. So once you start doing this, then Claudia's gonna be like, where else can I treat? This product also has an intimate line called Intima, so you can lighten, tighten, and brighten your intimate areas. I know, crazy. Before and afters. So if you're interested in learning more about that, but yep, all the Italians. And how was the treatment? Easy, right?
Yeah.
Nothing crazy. So
nothing
You already
crazy
have that little glow.
Yes.
Going.
And that's it. Very simple. Very simple. And this again is good for fine lines, wrinkles, pigmentation, hydration, acne scarring. So easy stuff. This is a whole new category, my friends. Like you can run from your needles. So pretty cool. Yeah, sure.
So we had some more people join us. So
Okay,
yeah.
All right.
For our second drawing. I'm gonna draw another name.
I know you guys are so quiet. You want to volunteer for us?
I really would.
Come on, let's go. Let's do it. I love it. I love the energy, and let's do it. Did you wash your face?
Oh, yeah, I did.
Clean face.
Uh-huh.
Okay. And we have makeup wipes too.
I don't use
So,
makeup.
No makeup.
No.
Right. Well, even do you have sunscreen on at all? Even just to be
No,
safe,
I
would
did not use sunscreen today.
And if anyone wants to grab snacks while we set up for her, you guys can. There's stuff out there and wine.
Yeah. I know. So tell me what you guys are thinking. Oops. Like too good to be true. You see all your faces.
Thank you.
For appointments to save just so much.
Okay.
That's like I said, there's no
Yeah. Tell us about what your
no downtime, and I just like.
That is kind of crazy.
Yeah.
I already see it totally like I have really strong, yeah, because I always do like this. But
Sean, come and talk
We'll
to
just do it every Friday.
We're talking about what our expectations are, right? What are we looking for?
Not mirrors,
Oh,
it's something to improve my
So we
appearance.
have here the 14th. So
Whatever I have to do.
Thursday.
Yeah, yeah.
I'm not ready for any kind of surgery.
Right.
Mentally.
Right, yes, yeah, or the cost too, you know? Now, looks like you have a little rosacea too, so this is actually.
I do have rosacea.
And pigmentation is different with every patient. So some patients that I have found, they will have pigmentation actually come right to the surface, like an IPL, like bringing the browns and reds right to the surface. I have a feeling you might be that patient, and then other patients who don't have that at all. Everyone is hit or miss, but it's nice. It's basically a product that's going in, pulling out your browns and reds.
And then does that fade away?
It does. It fades like within 24 hours.
Now,
So
I had
it's quick.
rosacea so bad at one point, I had the IPL laser, and
that really helped, but
Yeah.
now I just get it up in this area.
Yep. And that's what this is for rosacea.
So what I'm watching is PRX, because I came in late.
Yeah,
This is PRX
so this is PRX, yeah.
You do it once a week for 4 weeks.
Once a week for 4 weeks, yep. Unless you have your typical acne scarring, or if you're working on a scar, then you're gonna have about 6 to 8 treatments. Could be.
I have some indentations from, it was in an automobile accident from glass.
Yeah, and that's what this is for. This is 100%, like, I got bit by a dog, I have 22 stitches here, and so I've done this treatment like 3 different times. I've noticed a significant, like, just fullness in that area too. Your skin looks beautiful, by the way. You happy?
Yeah.
Yes, see? She's done, I know. Now it's time for a big hot date today.
Tonight is dancing and
Oh, tonight it is. Get out. Oh, nice. That's great. Good to know that.
Yeah.
Actually, it's bottomless mimosas at the Turnhouse today too. I just heard, so that's fun. Yep.
2 packages.
So yeah, so again, all we're doing is we're just prepping her skin. So you come in with clean skin. We're just prepping her skin with the pea solution. So this is just helping to pH balance out her skin. Easy, easy. It was an easy treatment though, right? Yes, easy, and it's so quick.
And there's no peel.
There's no peeling. There's no peeling. Because remember, this is not a peel. So this product is actually bypassing the epidermis, which is where peels work. Peels work just on that top layer of skin. The ingredients in this actually deliver the product right to the dermis. And the dermis is where your fibroblast activity happens, your collagen regenerates, so you're massaging the product right to the dermis.
And it should puff up all those fine lines.
That's what it's for, yep. Fine lines, wrinkles, it's regrowing collagen. So fine lines, wrinkles, acne scarring, stretch marks, cleavage, but it's good for pigmentation, for redness, rosacea, hydration, all over.
But not like age spots or sunspots.
Age spots too. That's your, yes, browns and reds. So pigmentation, yep, that's what it's for. On my phone, I'll show you some pictures too, if you want to see. If you follow me on Instagram, you can look at all of my before and after pictures. It's Jill.PRX Derm Perfexion. If you want to follow me, I have a whole thing of before and after pictures on there. So anyone at home, you got to follow me though before you look at all the pictures. But yeah, just look at the little before and after thing. But there's pictures of pigmentation, all skin types. So that's the big thing too. And all times of the year, like in the summer, who wants to get, hit with a laser in the summer? Like it's impossible to do it. So this is the perfect summer treatment if you want like a summer beautiful glow. This is the perfect summer treatment.
With her, with this rosacea, I'm expecting her to probably be a little bit more red than the average person would be. For instance, our other patient that we did was not very red afterwards. So I'm just telling you in advance, she may be.
But I have pretty sensitive skin, so it's for the.
And it's fine for sensitive skin. We had a treatment done this morning on a young girl that had very sensitive skin, like red hair, very, very, very sensitive. It's fine. It's more of like a stingling feeling, right?
Yes, I totally agree.
Right, nothing pain, none of that. How is the pill for you?
Okay. Okay, yeah, then you're all set. Is your daughter a current patient here?
If you have crow's feet here, you can actually take like a Q-tip even, or they have things that come in and get, so they can go right into the and basically just push them out. So
Which is in here.
Anywhere that you have fine lines. But it's different, but we're so used to getting injected.
I'm all right,
So
I'm fine.
used to like all, like laser, this is, it's not new. I don't know if you remember from the beginning.
Now you can
This was
put around
around
the mouth.
1996 in Italy. So this is an Italian thing. So we always get the good stuff last.
Okay, so you're all set now.
Yeah.
Thanks.
Now I have real things. So does this help pull them out any?
Well, it doesn't go over the
He is not, he's in a
So you can treat the lips with this. You are going to flake. That's the one thing with treating the lips. But you can certainly treat the lips.
And that will plump them up.
Yeah. So it's regrowing collagen. That's what it's doing.
Okay,
Yeah.
and what's your phone number?
I know. And I love everyone that I have these conversations with. Everyone crosses their arms. They're like, Jill, No, and trust me, when I interviewed with this company, I asked them all the questions. I was like, what about this? Let me see the pictures. Like our head of clinical, she's been Medspa, and she's been doing this for decades. She has millions of before and after pictures, so it's a new category. That's why it's very exciting.
This good for all skin types?
This is good for all skin types. It's factor 1 through 6, all skin types. Yep. That's what's nice.
All right, all people on. Are we talking price?
Yeah. What are you guys doing for? I don't do the price stuff here.
A series of 4 is $11.50.
And that's what you're doing for a special tonight. All that.
Yeah.
Okay.
And that includes the home care. Get the home care. And this is the last day of that sale that we're doing. A special pre-launch pricing.
So I see you're getting good pressure. What's the purpose of the pressure being so?
So you're actually massaging. So it's good. I like when new people come in because then I get to say it again. It's fun. And any questions at home, right? No, it's good. So this product, right, is actually bypassing the epidermis, which is that top layer of skin. So Alicia is actually massaging the product in, and the ingredients, it has TCA 33.3%, it has kojic acid, and then it has our proprietary hydrogen peroxide, which is the PRX, right? But those three together, the hydrogen peroxide like modifies the TCA so much that it delivers the product directly to the dermis.
Okay.
And the dermis is where your fibroblast activity happens, it's where your collagen regenerates. So the product is going directly to the dermis.
Gotcha. Then what about the neck area?
You can do this on the entire body. You can do this on the face, on neck, the décolleté, creepy elbows, creepy knees. They also have an intimate line.
That's real.
You can lighten and brighten and tighten your intimate areas.
Right.
No joke.
So it's good for intimate areas after getting, laser and different things like that?
You can incorporate this into any other modality that you're doing. Let's say that you wanted a hydrofacial. You could do this right after a hydrofacial. You could do this right after dermaplaning. The only thing that you cannot do this on is open, compromised skin.
Right.
Yep.
And would this be also good and beneficial for me with doing my massages?
Yes.
For my patients and
Yep.
clients?
Unless it's a Monday, you can go a little later on a Monday.
But you can incorporate this into your laser treatments. But I think of this product as like an IPL, where it's lifting pigmentation and redness out. Yes. And then it's also helping to regrow collagen. So it's tightening, it's toning, it's lifting the skin, it's regrowing collagen. So you're getting the whole thing.
So if you wanted to do like your elbows or something that usually a lot more wrinkles in your face, would that require more than the 4 treatments?
So the body is typically about 6 treatments.
Yeah, so then you would have to pay today.
I just started treating my tummy because just,
it's
AIDS and all the other stuff.
And that
I just started
includes
treating my stomach.
And that skin's going to look tighter?
On my phone, I have so many pictures, like on Instagram, you can see long pictures of bellies. This was designed for little kids with scars. So think
And then I'll grab
back on the brow top. Okay. You can do bellies, you can do the entire face, whole body. How are you doing so far?
Great.
I forgot you were right in front of me. No screaming or yelling, just jumping off the table.
So how do you incorporate it in with laser treatments or before, after?
You're doing. They can run through like different protocols with you. But if you're doing just like the skin pen or just the microneedling with no heat, you can actually do PRX the same exact day, even. Because it's Jill, if you follow me, it's Jill, and then at Derm or PRX Derm Perfexion.
I hear you were the lucky
And then
winner.
on that, there he is. Are you gonna come and say hello?
Sure, of course.
Come on.
There it is.
And then
Hot and sweaty from surgery.
the before and after pictures are one of the first things that are on there. Yeah, so if you tap that, you can see all of them. There he is. There's the hello.
Yeah,
How
was
are
good.
you?
It was like lower tinnitus.
We have a party up here.
Sometimes, and they put this.
You're still doing okay?
The man, the myth, and the legend, Dr. Markman.
Yes.
Take a nice massage, this facial
Say hello
massage.
to Did you
Hello,
get
hello.
the camera?
I was
We're
watching
live
back
on
there.
Facebook. Say hello.
Hello, everybody.
Tell
Not sure
everyone
where
what
the
you
camera is.
think
There we
about the
So, I haven't seen or done much with it yet. You're the expert with it, but the results I've seen definitely look beautiful. So, our patients, we're just getting started with that. So, but looks very nice. The results are amazing.
And easy,
Yeah.
right?
Yeah.
Quick
Oh,
and
very
easy.
easy, yeah.
Easy, easy.
It's nice having no peeling, no downtime.
Your week is finished.
All right.
There
we go.
Thank you.
You wanna hand her the mirror? Right there?
Here you go.
There it is.
So
There we go.
Blush a little.
A little red. I have rosacea.
Uh-huh.
Yeah.
All right.
We can fix that too.
Yeah.
Good, okay, great. Now you gotta sign up for your other three.
I will.
No, this doesn't do anything for rosacea, correct?
It does, so
Oh, it
it'll
does?
work for rosacea, yeah,
Oh, nice.
for brown, reds, all of it.
So
even
go back,
acne,
you've done
it's
love
for
for
acne. Wait,
I
just
knew
the
about the
yeah,
didn't
go
know
back
about the rosacea part.
Yeah, so anything good for hydration, but as long as you don't have to go to dry skin or breastfeeding, which I know.
Mhm. Yeah, I can't do it right now.
And then, here, right here. Alright,
Okay,
any other questions?
shut this down. Or Sean. No.
Well, thank you for joining us.
Cool, yeah, call in. What's the
Call
number here?
in 410-465-3600. And like I said, tonight is the last night of our special briefing, so it's going to be 11:50 for all 4 sessions, and that is in the home care as well. So, oh my gosh, the phones are ringing like crazy.
Alright.
Well,
Did
nice.
it finish?
Coming.
I don't.
Hope you enjoy it.
Thank you.
Absolutely.
Hey, Uka.